hope is on the horizon for cancer patients who often have to endure a form of insult on top of injury, the effects of hair loss while undergoing chemotherapy. In a New Zealand first, Nelson Hospital is running a pilot program funded by the Breast Cancer Foundation that uses a special scalp cooling machine to reduce the risk of hair loss during chemo. Here's our Nelson reporter, Tracy Neal, with the story.
After the shock of a cancer diagnosis, doctors and patients say chemotherapy-related hair loss ranks near the top of many women's fears. A former hairdresser, Raywin Robertson, who underwent cancer treatment 3 years ago, says it can lead to a crippling loss of self-esteem. It's also like wearing a badge that tells others you're ill.
When you lose your hair, people automatically think you're sick and treat you differently. They don't know how to respond to you, they don't know what to say to you. You sort of feel inferior, although you can be quite normal feeling on the inside and go out and then somebody will look at you funny and you just feel little again.
The Breast Cancer Foundation has spent $67,000 on the pilot scheme. It includes a special scalp cooling machine and a specialist nurse to operate it for 6 months. It works by making the scalp cold enough to constrict the blood vessels, limiting the amount of chemotherapy that reaches the hair follicles. The Foundation's chief executive, Evangelia Henderson, says the aim is to improve the quality of life of women undergoing treatment.
It's hugely distressing for patients, and so why have them go through such a distressing time if they don't have to? So this is why it's such a great pilot.
Ms. Henderson says the pilot is specific to breast cancer patients, but the technology would be available to patients with other kinds of cancers if it's adopted elsewhere in the country. She says it's been used overseas for some time and is proven to work on most people.
And whilst it doesn't help everybody, not all women react the same way, we're hoping that more than 50% of women undergoing chemotherapy whilst using the scalp cooling will keep their hair.
Breast cancer is the most common cancer for New Zealand women, with 3,000 diagnosed each year. Oncologist Kate Gregory, who is leading the 6-month pilot project at Nelson Hospital, sees between 4 and 5 new patients each week. And she believes patients who feel good about themselves respond better to treatment.
You know, I do think that patients who sort of manage to carry on their normal lives as much as possible do seem to cope better with things, you know, that normal life is continuing. And I think that is important for people if it's at all possible. And I think, you know, some women who lose their hair, some women cope with it fine and it doesn't really bother them. But others, I think it is challenging for people.
Dr. Gregory is grateful that the Breast Cancer Foundation and the District Health Board are willing to trial the cooling cap technology. Hairdresser Raywin Robertson says it's fantastic news. She says hair grows back after chemotherapy, often better than before, but the main thing for patients is to learn how not to feel bad about themselves.
Go and talk to people about it and see how they've coped with it. There's funding for getting wigs and things through the Cancer Society. The government funds a percentage of it, so definitely go and do that. They're specialists in their fields to provide the wigs and suit your face shape. It's fun. You know, wear a couple of wigs or wear scarves.
The Breast Cancer Foundation's Pink Ribbon Appeal is tomorrow and Friday. In Nelson for Checkpoint, Tracy Neal.